warahmatullahi wabarakatuh. And hello everyone, welcome back with me, Mardewi. So today we are going to discuss together about language disorder, which specifically we are going to talk about aphasia. And I do this part to fulfill my assignment from Ma'am Nirma Paris as my lecturer in Psycholinguistics course. So, to shorten the time, let's get started. So what is aphasia? Aphasia is a communication disorder caused by damage to the part that regulates language in the brain, generally on the left side of the brain. This brain damage is usually caused by several conditions such as stroke, head injury, tumor, or brain infection. The result of this condition can affect a person's ability to produce language, comprehend, write, and read. This can be seen by some of the symptoms, such as difficult in speaking, difficult in understanding the content of the conversation, difficult in writing, difficult in remembering words, and understanding what is written. Next, let's talk about the types of aphasia. The first one is actually broadcast aphasia. It's actually related to the difficulty in speaking fluently, but comprehension remains good. The second one is Wernicke's aphasia. It's related to the language comprehension is impaired, although speech is still fluent, but often doesn't make sense. The third one is global aphasia. It's the combination of Broca and Wernicke's aphasia. The fourth one is anomic aphasia. It's actually related to the difficulty in finding words or naming objects, but other aspects of language remain relatively good. The fifth one is conduction aphasia. It's actually related to the difficulty in repeating words or phrases heard and may have difficulty in understanding complex sentences. The sixth one is transcortical sensory aphasia. It's related to the difficulty in understanding speech but can repeat words and phrases fluently. The seventh one is transcortical motor aphasia. Means it's difficult to initiate speech but still able to repeat words and phrases. So based on the several types of aphasia disorder that I have already mentioned before, it's very important to consult a doctor or speech pathologist for proper diagnosis and treatment. So in this video, I will give you an example of aphasia disorder itself. So let's see the picture. Here's an example that I got from YouTube where a father of Amanda named Jean who has aphasia disorder caused by stroke. Based on the video, Jean has global aphasia where there is a difficulty in producing and understanding language simultaneously. From this example, there are several methods or treatments and therapy that can be provided for people with aphasia, which of course must be adjusted to the type and severity of the patient's condition. These treatments and therapies include, the first one is speech and language therapy. This therapy helps patients improve their ability to speak, understand language, read, and write. The second one is actually technology-based therapy. Electronic communication aids and apps designed for people with aphasia can assist in speech and language comprehension exercises both in the clinic and at home. The third one is alternative and augmentative communication approaches. These techniques use pictures, gestures, or other aids to help communicate when it's difficult to use words. The fourth one is family support and education. Involving the family in the therapy process is important to help patients feel supported, understand their condition, and improve their daily communication. The fifth one is neuroplasticity therapy. This therapy uses techniques that stimulate the brain to recreate the connections between language areas with the aim of aiding the recovery of language function. And one more thing that we have to know that aphasia is also a disorder caused by some of conditions including accidental brain injury, so that medical treatment is also needed in this case. So maybe just that the explanation about aphasia disorder, and apologize me if I have mistakes. And the last I say, wassalamualaikum warahmatullahi wabarakatuh.